Welcome to the True Hunt, and to honor the World Occupational Therapy Day, we have got Dr. Joseph with us, and the day was celebrated on the 27th of October 2024 in Mumbai. Giving a brief about Dr. Joseph. Dr. Joseph is an occupational therapist from Kerala, India, with an inspiring 22 plus years of experience in the field of pediatric and adult occupational therapy and rehabilitation. His contribution to the field of occupational therapy have been significant and are widely recognized by his peers. He is honorary secretary of All India Occupational Therapist Association. Apart from that, he's also a president of Kerala Occupational Therapy Association. He is also currently serving as the Senior Occupational Therapist at the Government of Mental Health Care in Thrissur. Sir, welcome. And first of all, belated Happy Diwali to you. And apart from that, many congratulations for the World Occupational Therapy Day. Now, coming to the question that starting with your association, that what does the All India Occupational Therapist Association is all about? Please.
Thank you, Gaurav. Thank you for the wonderful introduction, and Happy Diwali to you also. As you said, like we celebrated our World Occupational Therapy Day in October 27th in Mumbai. All India Occupational Therapy Association established in 1952. It is the World Occupational Therapy Association is started by Kamalavi Nimkar. She's an American lady. She was in India, and she is the person started this association in Mumbai. And initially the department started in KOTA Medical College. And this is 72, more than 70 years we have this association. So we have got branches all throughout the country, throughout all the states in our country. More than 5,000 occupational therapists are members of our association. And we also have an academic council of occupational therapy. This Academic Council of Occupational Therapy is the, we give accreditation to the occupational therapy colleges in India. So we have occupational therapy college, around 50 colleges in India. So we have a World Federation of Occupational Therapy called WFOT. So around 111 countries are there in this association. So India is the founding member of this particular association. So World Occupational Therapy, this WFOT has set a minimum standard for occupational therapy education. For example, for an occupational therapist who studied from India, when they go to US, UK, Canada, or any other country, I told you about these 111 countries. So we ensure that the Academic Council of Occupational Therapy will ensure that the minimum requirement, the minimum standard of the curriculum is maintained by each and every college in India. So we do an inspection there. For example, we see the curriculum of the particular college, and also the department, their library, their lab facilities, classroom settings, faculties. So there is a minimum criteria for it. So we go and do the inspection there. And these colleges are there in central government institutions, and also state government institutions are running the colleges. There are national institute and state institute also. Then private medical college also running this course. The course duration is 4 years and 6 months.
As you are talking about the academics part, and recently with the Changing India, which has brought the new Education Policy 2020, which has already been implemented and roll over, and slowly the institutions are adapting it. And your program is also talking about the skill-based training modules for final year students and interns, and you're also talking about the central government institutes and other stuff. And being yourself from the academic field, where you have done PhD, and of course your education started from the SRM Medical College in Chennai, then the PhD part, then you went towards the University of Southern California. So with the changing new India, with the NEP Policy 2020, how do you see the things? Are yourself working on the pathway of the NEP 2020? Could you throw a light on that, please?
Yeah, we have, we see the Academic Council is conducting various certification programs, fellowship programs, and workshops and training based on this particular national education policy. So what happened is like, when these students, when they pass out of the college, they can take additional courses. For example, ergonomic certification. Ergonomic something, when you are sitting in a chair, I am also sitting in a chair. So the design of the workstation, basically the chair, table, and a person who is sitting in the computer for a long time, they'll get a lot of back injuries and all. So we have a separate program for ergonomic certification. So once the occupational therapist is trained in this, they are skilled to assess the environment, work environment. So when they change the work environment, the person will not have injury while sitting for a long time. So that is one program, and we also have many. Every year we are conducting many programs, and we associate with various universities, and institutions. We are conducting this program.
So sir, we are talking about again my point now, the new healthcare system, what we could say, or our healthcare system is now more citizen centric, giving
Yes.
priority to health first. So,
Yeah.
what would you like to say in one or
Yeah.
two
See.
sentences?
Yeah, I'll give you some example. Like, there is an act called RPWD Act. Earlier, the act was called People with Disability Act. Now
Yes,
the act name has changed to Right with Person with Disability Act. So every
2016.
citizen of every citizen of our country, they have the right to get the treatment. So
Yes,
no, not for just for a cold or fever or any type of accident or injury. Once a person get an injury or a mental health issues, they have the right to get the rehabilitation also. So as part of the Mental Health Care Act and as part of the RPWD Act, so each citizen of our each citizens of our country, they are supposed to get this kind of rehabilitation. So now what is happening is like, once the act is implemented in a proper way in each and every state of a country, for example, Right with Person Disability Act says that you should have a wheelchair access in everywhere, and there should be ramp. It should be disabled friendly. So similarly, each and every patient, when they go to a hospital, he or she should be referred to an occupational therapist if he needs. That is his right. So this has to be sensitized among the policy decision makers and also to the medical fraternity, because general public may not be knowing about the super specialty. For example, the rural area or a person who's illiterate, he or she may be knowing about a doctor and nurse. They may not be knowing about what is a super specialty or
right.
pediatric neurology or a neurologist or orthopedician.
Yes. Yes, so then we can say that together with the combination of the
Yes,
modern medicine, the Ayurvedas, the allopath, and of
yes,
course with the super specialty now, we could combine it all together and give our citizens the best healthcare system in India, which we
yeah.
are working on and hope for the best. Sir, my next
Because
question.
see, the thing is like when a person is getting a disability, it is going to be a liability for our nation,
Yes,
our government. So
yes,
we have to prevent the disability. That is also our
yes.
the government is taking a lot of steps. But only thing is, each and every state also has to implement this.
Sir, my next question to you, of course, talking about the women, which are well respected, and with due respect to all the women in the universe, and of course our Indian women as well. So, your occupational therapy talks about the wellness of for our women. So, how this therapy is working? Any specialization program you would like to talk about? Please throw a light.
Yeah, yeah. See, women are the, when they actually, there are a lot of program for women, especially to improve their metabolic activities. They're checking their, regular checkup in the health system. That is happening in regular way. But no, when this, mother, when a woman is going to become a mother, so antenatal care is very important. So there are lot of role in occupation therapy, because we can actually educate this parent about the child, planning a child, and what is the development, motor development, when the child is supposed to achieve the head control, when the child is supposed to turn around, what is the milestones. So this has, and what is the importance of feeding, and especially I told you earlier about the children with babies, with the preterm babies. So
Right.
when the mother is actually going to be in stress, lot of mothers with a lot of women, they work in IT companies and various areas. So you know that nowadays people get a lot of stress and anxiety. So when we can actually work on their quality of life, they should be able to balance a work, leisure, and play. So when they have work-life balance, they'll be able to give more productivity in their work, and also they'll have a quality of life. So to the women health, occupation therapists are playing a major role in this.
Sir, my last liner to you, we would be wrapping up the session. Of course, as you are aware that we are on the path of Viksit Bharat, a developed India, a developed country. So,
Yeah.
with from your healthcare perspective, healthcare system perspective, how do you see this pathway for Viksit Bharat?
Yeah.
Please,
See,
your one or two liner on this.
yes, as I told you earlier, when the India wants to become a developed country, I told you about certain acts called Mental Health Care Act and RPWD Act. See, why we are signing this MOU with the UNO is, India should compete with the other countries. For that, our nation should prepare in these areas. So as I told you earlier this occupation therapy was popular in developed countries. Now now the awareness about occupation therapy has come in India. India has got a lot of potential because our therapists are working in US, UK, and Canada, and they're doing well. So these act like RPWD Act and Mental Health Care Act, when it is enacted in each and every states, when it is implemented, why they are signing is MOA is because the quality of the patients should improve. We should give them the maximum health care. So occupation therapists got a major role. So that is why the central government has come up with the National Commission for Allied Healthcare. So once this council also come, our regulation of practice and also education standard also will improve. Lot of job opportunities, lot of general public will get our service. The government will be able to give free service to our citizens of India. With that, we can become a developed country maybe in after 10 to 15 years or 20 years later.
Yeah, this would be one hand in the contribution towards Viksit Bharat. Sir, this was Dr. Joseph with us all the way, who has joined us from Dubai. Sir, thank you so much